We're on your side tonight with the new long-awaited health care plan from Congress. It has been a pivotal subject for decades here in the U.S. Congress passed the Affordable Care Act under President Barack Obama in 2010.
And ever since then, there's been numerous attempts to end the program or at least strip parts of it away. Let's give you a recap of that.
Now, the program created the federal health insurance marketplace, which went online in 2013, protects people with pre-existing conditions, allows young adults to stay on their parents' plans until age 25, and requires large employers to offer affordable, minimum value health insurance to most of their full-time staff and dependents.
Now, as of just 3 days ago, there were more than 2 million new ACA enrollees. More than 19 million people re-signed their ACA plan for this year as well. Focusing on just the Carolinas, show you those numbers, almost 756,000 people now enrolled in North Carolina. In South Carolina, that number is nearly 576,000.
People enrolled under the Affordable Care Act are dealing with higher premiums this year because Congress did not extend certain tax credits that expired last year. So right now, the Affordable Care Act and its mandates are U.S. law. But today, President Trump is unveiling a new proposal.
We're calling it the Great Health Care Plan. The government is going to pay the money directly to you. It goes to you, and then you take the money and buy your own health care. Nobody's ever heard of that before, and that's the way it is. The big insurance companies lose, and the people of our country win.
Today, the White House released this video by the president announcing his, quote, Great Health Care Plan. It's a multi-part proposal aimed at lowering prescription drug prices, reducing health insurance premiums, and increasing price transparency within our healthcare system. It's no doubt that the U.S. has some of the world's most expensive and complicated healthcare systems. The Trump administration says, quote, big seismic shifts are needed to address issues within our system. So what is in the proposal? Sending federal premium tax credits directly to consumers rather than insurance companies.
It would resume federal payments for a second set of ACA subsidies that reduce out-of-pocket costs for low-income enrollees. But doing this would likely raise premiums for a wide variety of people with marketplace coverage.
Another part of the proposal could get complicated: price transparency.
The Great Health Care Plan will maximize price transparency by requiring any healthcare provider or insurer who accepts either Medicare or Medicaid to publicly and prominently post their pricing and fees to avoid surprise medical bills. This is an incredibly popular policy that has been bipartisan for many years, and President Trump is officially and firmly calling on Congress to get it done.
The White House says this will encourage people and employers to shop for more care and coverage. The first Trump administration required hospitals and insurance companies to post certain prices, but experts say most patients don't shop for care. Also, some hospitals have used the data to try and negotiate higher payment rates from insurers and employers, even as they push to lower how much they pay providers. The Great Health Care Plan also targets the price you pay for prescription drugs,
permanently lowering prescription drug prices. Congress can get this done by codifying President Trump's historic Most Favored Nation initiatives into law to guarantee Americans the same low prices for prescription drugs that people in other countries around the world pay. Additionally, by increasing consumer choice by making more verified, safe pharmaceutical drugs available for over-the-counter purchases.
That Favored Nation initiative was announced in mid-December. The White House says 14 of the 17 largest pharmaceutical companies signed Most Favored Nation pricing agreements. So if prices for a drug are lower in France compared to Germany, Americans would pay the same costs as they do in France. But just 12 days after this announcement, we got some other word here. Reuters reported that drug makers were planning to raise prices on at least 350 branded medications this year.
What's important to note, while a health care proposal from the White House is a big step towards making a deal, it's a framework. President Trump now wants lawmakers to take this framework and put it into more detailed bills that could become law if passed.
All right, from Washington.